we're back, and we're moving into our first conversation for today. We're joined at this time by the Executive Director of the National Council on Aging, and Ix-Chel Poot, and Ivorine Bulwer, the Executive Director of HelpAge Belize. Good morning, ladies.
Good morning.
Pleasant good morning.
And we're taking the opportunity to focus on a very important population in this country, which you both work with directly, as we prepare to celebrate World Elder Abuse Day on June 15th. Good morning.
Good morning.
Good morning again.
So, before we start talking about the abuse of the elderly, which I think is just such a morbid topic, I kind of wanted to just get an overall profile from both of you as to where we are in terms of monitoring the aging population and how much it's growing.
Well, there's definitely gaps and need for more baseline data.
Yeah.
The last comprehensive studies we've done all date back to 2010. From the Council's perspective, I know that HelpAge Belize continuously does data and runs small studies on their population, which is very representative of the overall aging population. HelpAge has the largest network of service provision across the country, so they serve a large population of older persons. But when we're looking at aging, I know very often we talk about assessing the older persons themselves, but we're also interested in assessing what's happening with the age groups coming up. How are 30s, 40s, 50s, how are they feeding into the 60s? And so we're looking very much towards the census in 2020, which will probably, or which we're hoping will give us a lot of baseline data on where we are with the older persons, but where our population is also seeing shifts towards aging.
Yeah.
Are there any concerns with that soon-to-be older population?
Yes, quite a number of concerns.
Quite a number of
We
concerns.
have to look at the issue that we're going to speak about as it relates to abuse. We need to look at the non-communicable diseases that are affecting our population. We look at the survey that was done in 2006, which shows 13.1% of this adult population are suffering with all the non-communicable diseases, diabetes, hypertension, the heart problems, and also the HIV. So there are implications for older persons. Additionally, we have got to look at safety issues for older persons. We are partnering with the Association of Planners, because we need to have information as it relates to safety and security of our elderly. In the event of any disastrous situation, we need disaggregated data. Where our elderly are living, how many of them concentrated in specific areas of employment, areas of high crime. So these are social ills that are affecting the general population and thereby also affecting the older population also.
One of the challenges that we did face early on is that data disaggregation would stop at 55 plus. And then you would lose, what's happening with those who are 60, what's happening with those who are 70 or 75. And we understand that as persons become older, they become more vulnerable to certain elements in the society. And there's definitely a need to look at what is the socioeconomic status of our population. How are we actually preparing to be retired or to have no income from employment? And that is always a challenge for our older persons. When we look at those situations, the study that we did with HelpAge International in 2010 showed us that 61% of all our older persons now had no access to pensions or income from pensions. So
Wow.
how are they surviving?
Yeah.
And so that's one thing to look at that generation of older persons, but then what does it mean for our 30-year-olds or 40-year-olds or 50-year-olds? Are they then investing in their retirement? Have we provided avenues for that investment, education for that investment? So, those are really some of the parameters that we have to consider when we're talking about an aging population.
I think also we need to look at the social areas. Ix-Chel share about that economic aspect. You're talking about older population. They don't have access to pension. the government, the current older population, there are small numbers of persons who are receiving the government pension. You're looking at the Social Security pension. The Social Security came in existence in 81. So they are not a recipient of Social Security. And it does affect their welfare, their economic survival.
Yeah, of course, some of them are collecting very little money.
Very little,
Which
or
they're
nil.
so
or nil.
dependent on
Yes.
as well.
And if you look at it, it impacts negatively on older persons. The environment is not conducive to older persons. It's not friendly. Yeah. You walk the streets. They cannot walk on the streets. The number of potholes, the unevenness, it's unsafe. And at the same time,
to access public transportation,
yes,
carry out your own,
it is sad.
business.
Screening, health screening for elderly, follow-up intervention, diagnostic. There's certain, with age come illnesses, but there need to be wellness. Where do they go for screening? One, there are services there, but the access, the transportation, as Ix-Chel had indicated, that's an issue. And paying for these services, yes, we do have the National Health Insurance in existence, Belize City, down south to some extent in Corozal. But the accessibility, there are basic services that are non-paying. But for diagnostic intervention, for example, they want to do screening for the prostate. It comes with a cost. They need to get breast screening. It comes with a cost. Just the level of maintenance for blood diagnosis, they need to move around, and they don't have access to finance. And we're coming to this topic as it relates to elder abuse because of
How
the
common
absence.
Is it?
Abuse? It's common.
It is underreported.
And
that's
it's
the challenge.
underreported.
What type of abuse are we talking about?
If you look at the data, you look at international data, it's clearly showing the psychological abuse very high. Financial abuse, neglect, I'm telling you, neglect, financial abuse, psychological abuse is prevalent within the society. It's within the homes, it's within the residential section, and within the hospital setting. You know why I said in the aspect of neglect. When you look at neglect, you're talking about ensuring older persons are fed in whatever setting they may be. You're talking about older persons, if they are not well, are they being turned as they should be turned? If they lay in one place, it affects the circulation. And if they are not turned, at least every 2 hours or so, they develop pressure points over the bony areas, and they develop bed sores, and that is common. And we see it within areas where persons should be cared for, persons should not be harmed. You're seeing that area of neglect.
What I hear when you say that, because I think sometimes the assumption when we talk about neglect, we think of an elderly person living alone and not being visited or cared for. But you're saying it also takes place within when they're staying with families.
Exactly. One of the important components too when we talk about neglect is basic access to hygiene materials that they need, and that component of maintaining the wellness and the dignity of the body as well. Because and it's so important that Ms. Ivorine is here, because HelpAge Belize is one of our front responders in a lot of these cases in the communities. They are the ones who will receive the call first and foremost. At the council, we will receive calls, but HelpAge will receive the calls, and because of their program where they go into homes, they get to see this right on the front line with their caregivers. And sometimes it's really challenging, because it will be an older person is left alone, and they don't have water for that day, and it's something that they're left alone, and when somebody comes home, they're waiting, or they have an issue with incontinence, and they remain in the same.
What is incontinence?
Unable to control their bladder.
You're looking at
So
the
they
bladder,
may-
the
they may
stool,
pee
and
themselves.
urine,
Yes,
and they're
yeah.
there for hours. But also very important, we need to look at the cost
The cost.
for purchasing these Pampers. It's exorbitant. So we have a lot of work to do.
It's what it's like.
I like to broaden the conversation a bit. For me, it's a bit personal today.
Yes.
But I wanted to have a bigger conversation about. There's a story that there's a culture that when the population got old, they put them on an iceberg and they shoved them off, and they would die. I wanted to know, apart from anecdotally, how we think we treat our elderly people. How exactly is the culture of Belizeans as to how we treat our elderly? I know that our social security has a special place for them. I know the water company has certain discounts that they do, utility companies.
BEL.
BEL.
Yeah.
I know that the banks have certain lines for our
Some
elderly.
banks.
But how do we really, as a people, how do Belizeans treat our elderly?
It's an area of concern. It's like you're getting older, okay, you just need to rest, you just need to relax, or they serve as caregivers for their grandchildren. Very important is to look at how do we, as a nation, not only for the elderly, but along the life cycle, how do we facilitate wellness, a healthy lifestyle for all?
So that
And
encouraged through the life course.
Yes, and very important, we're seeing what we're observing within our setting is that, okay, they're just there, they're just existing. If you don't use your brain and not stimulated, you get lost.
So I think similarly what we see as well is that if you have older persons directly in your life, if you're living in that intergenerational family setting, there's a larger awareness. But for the population in general, if they're not right in front of you, then they kind of remain invisible for most part. And also, unless you've had a hands-on experience with someone who is aging, the issues that affect an older person are very foreign to the general populace. And that's, one of the challenges that we do face that people cannot understand. And I know I've said it before, and it's something that I normally say when we're doing workshops, is that we all identify with children because we remember what it's like to be a child. But you can't necessarily identify with someone who is 70 because you've never been 70.
You don't know what arthritis feels like, or knee pain, or all the other challenges. But that was really going to be my point, because the elderly is considered a vulnerable population, and with very good reason. And I think, when you think of perhaps persons with disabilities, it's the same challenge. You don't know what they're going through. You don't know the extent of the pain or challenges. You walk up a flight of stairs, you've never thought of what happens when somebody appears there with terrible arthritis, or if they're in a wheelchair, and just the absolute devastation they must feel, realizing this is their only way in. So there's a major disconnect, and I guess it goes beyond just the exposure, but it's also a bit cultural. And I wanted to ask, there's so many facets to what you guys do. One is the education and awareness, and I can never forget when you taped up my fingers to make me experience. I've heard of the beans in the shoes, so that we understand some of the pain people have in moving around. So the awareness is such an important part of it. You're talking about addressing the needs of the current elderly population, but then you're also looking long term, because we've a growing elderly. We've always said a couple of years ago, we have a youthful population, which means at one point we'll have a very big elderly population as well, depending on how many make it to the point of being elderly. So what other agencies are involved? You have National Council of Aging and HelpAge.
We're looking at health. We have got to look at our social partners.
Yeah.
And I just want to share with the public, with health, we were able to procure a geriatrician and a physiotherapist. All right, and currently services are being offered within government centers in Belize City and San Ignacio. At the same time too, we're looking at next year we should be getting an occupational therapist, is to look at clearly the quality of life for our older persons. How do we keep our older persons healthy? We're looking at the physical aspect, we're looking at the social aspect. And as we're on social, we should be getting 2 international volunteers in September. Had a discussion yesterday, and so one will be assigned to Belize City, one will be assigned to San Ignacio. But HelpAge will be partnering with educational institutions and other social partners because we need information. We need to do research on issues impacting older persons. We have done so far 2 researches on the elderly with the Cuban geriatrician and physiotherapists. And we have the findings for those researches. You know, so we need data.
In what specific areas were those?
We're looking at the aspect of mobility, all right, fall prevention.
Yeah.
Because one of the things we don't really talk about a lot here, and it's so important that HelpAge Belize looks at falls and falls prevention, is because falling for an older person is literally a life-changing intervention. It changes everything, and it even determines length of life on what happens with that fall. The council has a large board, and on our board we have partners from all entities. We do work along with Mercy Care Clinic, and one of the things we made a move towards at our anniversary this year is trying to create a national coordinating committee which will feature all our partnering agencies like HelpAge or other service providers. They're trying to strengthen that network because, as in many other areas, there's always need for strengthening network collaboration and looking at what we have on the ground, what we can build from, and where the gaps are that we need to fill in. So that's definitely something that we've been working on this year, to kind of bring all our partners on board and looking at really and truly a national direction for the push of the implementation of the national policy on aging, but also the important advocacy work that still needs to be done with the aging population.
You know, as we're talking about abuse prevention, the opposite of it is really elderly support. And you don't realize how difficult it is and what it takes, not only financially, but also psychologically. I had the very unfortunate experience of having my 2 grandmothers being very ill at the same time. And just a simple thing like taking care of them, it's like you have a second baby. As you say, you have to be turned, you have to be fed. And remember, we're talking about an adult who's in a baby form. So they still have the mental capacity
Who still wants independence.
Who still want their independence.
Yeah.
What is there in terms of psychological support for the families? Because there's always somebody there. Because most of us can't afford.
Very important, very important. That's an area where we make great efforts to assist with home care. Going into the home, providing baths, if they're observing the skin, if there are areas we need to address like pressure sites, they're bringing the geriatrician and the physiotherapist. I think also very important that family need to provide support when someone is ill. You look in a hospital setting, there are shifts. You work 8-hour shift or 12-hour shifts because persons need a break. And when they don't get that break, they experience stresses, they experience depression. And this is where sometimes oftentimes abuse stems because it's a risk factor. So also we need support group. We need support group for the caregivers. Caregivers experience intense stresses depending on the older person's condition. Sometimes they have certain form of dementia and they're restless.
And all you can do at that point in time as a caregiver is manage behavior. And I think that's one of the challenges that many people don't understand unless you're actually in those shoes. That a caregiver's job is taking care of someone, but they themselves need care and support. We recently had a volunteer approach National Council on Aging. She comes working experience from the Trinidad chapter of Alzheimer's Association, looking for opportunities to create a support group within the Belmopan area. Just because she has the background knowledge and has worked with it before and sees the necessity, because many times caregivers feel isolated because your life collapses.
Completely.
It collapses. All your extracurricular activities evaporate.
Yeah.
You're not resting the way you need to rest, and there's always in the back of your mind that something might happen, you might not be there, or something might happen and you are unable to handle it. And so there's a large amount of stress that happens to the caregivers.
And caregivers of Alzheimer's and dementia specifically are under a particular level of stress that I think people don't understand because of the rejection they face by the elderly person as well, and sometimes the aggression.
Yes.
In those cases in dementia, and I'm sure Ms. Ivorine will agree, in the case of dementia patients, who you really need to support is the caregiver.
Yeah.
The caregiver
The
needs
caregiver
support.
needs a large support system, a large network. You know, often when the council is approached by persons, you know, we always tell them, you need half an hour, at least half an hour in a week, half an hour in a day. That's just your time.
Yeah.
Where you can, if you want to read a book, if you want to take a nap, if you have to be able to arrange with your family so that you can step back, because it becomes overwhelming so quickly.
It's interesting you say that, but oftentimes you find out that primary caregiver is all
No
alone.
break.
There is absolutely no support, and they do experience stressors. I think also important, and it's something that we're agitating for, we have got to look at standards for operating residential homes.
Definitely.
Or care homes for assisted living facilities. Because persons within facilities need to be trained. They need to have knowledge, they need to have...
But how many home care sites do we have? Is it only 2?
No.
No.
Octavia,
Three,
Wait, Sister
4, 5,
Cecilia.
6.
Okay.
We have 6. We have 2 that's run jointly by HelpAge and the government.
Okay.
Octavia Wait and Sister Cecilia's.
Yeah.
Golden Haven, which is run by the government here, which is 3. We
Yes.
have 2 that operate privately, which is Breadfruit Gardens and My Cielo Blue. And then there is a community-based home up in San Joaquin that also operates as a facility.
But those have to be catering to a very small portion of the elderly population, because
The one in San Joaquin...
the total population of those has to be, what, 100 maybe? 200?
Less, it's less than that.
less
And
than
you
a
look at so many
less, far less.
thousand persons who are
And
using, so
the
really
population increases by like 1,000, 1,200 annually. So
Okay, so at what
They're in
age do you
communities.
classify someone as an elderly? Let's
60
start.
years, 60 years,
60
60
years.
years,
60.
and over.
Okay. And that, I think I remember, is based on the Social Security classification of golden
It's
citizen.
international.
It's the UN,
international,
it's the
UN.
UN
Okay.
definition. Because the Social Security, I mean, in Belize, if we talk about retirement age, we're talking a completely different thing, because you have 55, 60, and 65.
yeah.
So, but the UN definition, the international definition of an older person, is anyone who is 60 plus.
So I feel, and I feel that hearing everything that you're saying, it feels like such a sad picture that is being painted of the elderly population. And that's fine. I think if that's the situation that we have on the ground, then we need to start to address it.
It is
But my
sad.
question is, where do we start? What is the most critical area of action that has to be taken so that those who are elderly now will have an improved quality of life, and those 1,000 people every year who are joining this category will also have an even more improved quality of life? What are the critical areas?
I think one of the most important things for people to do is to be able to report cases of elder abuse, because we do not have a lot of baseline data, and we need to be able to start building that data. And that's why it's really important, the mini studies that HelpAge Belize is doing, because that's adding to the data that already exists, which helps you to make informed decision. We can have anecdotal information, and that's all well and good, but we need to be able to have data that we can qualify and quantify and be able to show.
But how do you quantify something like what you've said? The first type of abuse you pointed out was psychological abuse. The berating, the belittling, the isolation that may take place. How do you quantify that? Because, I think when if I think of some of the elderly people in my life, sometimes it's sad when I think of them saying, well, I don't want to go around the young people. The young people don't want me around. Or, just kind of some of their challenges they have, or if you see how people interact with elderly people in the public, or same courtesies we'd expect that they'd give, they don't give.
You have to operate from different, from different fronts.
Yeah.
And in absence of data, you have to create that environment to meet these people, and this is why we have the day activity centers. We have 9 day activity centers across the country. Additionally, you know, we do this outreach. We also facilitate them registering with the National Health Insurance. We do home visits, outreach. We do outreach in Belize City and San Ignacio. And also we have got to look at their basic needs, and this is why we partner with businesses, individuals to assist family members. But we just cannot operate at that level. This is why we lobby agencies. We work with different agencies so that we can get the support services, the volunteers to come in, and like the social worker to do some research. We need data to lobby.
What about just some of the simple things? Because, and we've had this conversation before, just looking at access, preferential treatment in public buildings.
It's very interesting that you're bringing that
I
up.
still think of, you know, when I go into a bank and I don't see a clearly defined elderly space.
Very
Don't
interesting.
expect them to ask for it, because there's a level of pride and independence. There should be a clearly defined elderly area. Public transportation. Have you seen this, the height of that first step for a bus and the way
They talk
people are
about-
rushing
They
on?
talk about the seating on the bus. But actually, the council has been working over the last year with support from B&E Trust and in collaboration with our partners. And we're getting ready to launch, actually in July, what we're calling a front of the line campaign, which is exactly towards preferential access. And it's in recognition that something as simple as preferential access helps to provide a certain safety net within our society. An older person who is able to go out and carry out their own business is less likely to be affected by financial abuse. An older person who is able to interact within the public safely is less likely to face isolation. I mean, there's still other things that tag on, but that is something very simple that we can all do. Businesses can provide a preferential line, and then customers can respect a preferential line. And by being able to do those two things, we are ensuring a level of safety and social protection and connectedness for our older persons.
Look at the problems that we're having with child abuse. We don't have a handle on it at all. Anybody who says that, I think, is delusional.
Yeah.
We don't have the facilities to deal with them, or institutions, the courts. Even the church is not properly prepared to deal with it. So let's shift that now, and we are nice and fuzzy, and we feel very emotionally attached to what goes on with the child. We're not as sympathetic, to my mind, with what goes on with somebody who's elderly. Do we have the facilities to be able to deal with elderly abuse? Simple question. I see my neighbor hit their grandmother, for which you'll go to hell, and you should also receive a capital offense punishment. I report it to the police. What happens next? Because after that person is charged and there is no longer that financial support, no place to live, where does that person go? For a child, you know what happens. And the courts are familiar with what's going to happen. But what happens for an elderly person when you actually take away, even if it's an unhealthy support system that's around them, when you take that unhealthy system away from them, where do they go? What institution is there for them? Do we have sufficient?
You know, there's older persons are not protected the way they need to be under the legislation, under laws, and we often have to think very creatively about how you are going to protect them. One of the things that you'd have to understand as well is, in a case of a situation of physical abuse, that older person will actually have to state that that did occur. So you might say, yes, Sine hit her, but the older person will also need to say, yes, and I want to press charges.
And oftentimes the person will not do that because
Exactly.
of fear, dependency.
Dependency.
Yeah.
I think it's very
There's no elderly
important
foster
too.
care that you
Yeah.
can take them out and put them in.
And you know, that's
The-
one of the challenges that the Department of Human Services has indicated on more than one occasion, that there is no respite care or foster care for older persons. Families, communities are less likely to take in an older person than a child because of what it means to take in a fully grown adult into your home who might have a mental health issue, who might have another health issue that needs
Who require a lot of care.
a lot of care. And in the difference, you know, and one of the differences with a child is the child might come to you in Pampers, but it won't always stay in Pampers. All right. Whereas an adult who comes to you with an issue that requires them to be using adult Pampers, that's
Remains.
where you're going to be, and you have to be prepared to deal with all of that. And so there's a lot of work that needs to be done in sensitizing, preparing families, and creating kind of a safety net where we can move older people along, because as we pointed out just now, there's limited space in residential facilities. So it's not as easy as there is someone in a situation where I can walk in and say, okay, so this is where you are, I will pick you up and I will just move you into a residential facility for the time being till we can solve this. It's not that easy.
That's not an option.
I think there's several fronts that has to be looked at, because that caregiver need to be educated.
Yeah.
And at the same time, how do we allow an older person to retain that level of independence as long as possible? And this is why we're seeking out a occupational therapist to assist in those areas. And we're looking also at a social worker, because we are going to engage in research. We need information. We can do several interventions as it relates to social programs and things like that. But we need
Where there's
data, and you
long-term
use
change.
those data to lobby,
Yeah.
to create that level of awareness. Because at some point, we collectively have to utilize our older persons to make demands as part of their rights. I think very important that we need to share, and we're seeing it frequent, financial abuse. Older persons signed over their properties,
Being swindled, taken
their
advantage
account,
of.
they have their account, they have made preparation for old age, family members, persons who have been entrusted in
Make
their
them
care.
change your wills.
And when
Empty
they
them of
reach
account.
that stage of becoming dependent, they are no longer appreciated. And so, you know,
It's so upsetting to hear all of this, but it's fine, because this is.
But it's
I've
for
always been an
real. It's
advocate-
for
no,
real.
I've always been an advocate of the importance of us as a country and as citizens to look in the mirror and see the reality of what's there, without the makeup that we try to put on sometimes. And the reality is that we're failing our elderly population,
Yes.
not for lack of trying, but because it's just not a priority area. This feels like a scenario, I think, where, you know, when you talk about how to eat an elephant one bite at a time. And so when I hear your front of the line campaign, I think that may be one way of getting people, and especially those who are still mobile, to kind of feel independent. The issue with the adult Pampers, though, I think is also another one that perhaps can change with lobbying. If you have a major expense in buying adult diapers, why not take this as a quasi-government, as a statutory body, to the representative departments and say, listen, we need this to be duty-free. This is an essential.
It should be a zero-rated item.
Yeah.
I mean, 10 adult Pampers cost what, Mr. Reed? Like $15?
it's between $15 to $18 depending on the type.
So imagine,
Size.
For 10.
imagine them not being they do this with children. So I could only imagine how they do it with the elderly, where you don't change a Pampers because you have a limited set that you want to use.
yes.
So these are little things that I think can be done to alleviate the cost of care. Have you ever tried to lobby for this change?
Not recently. I know when I came onto the council, and I've been with the council for a while, there was discussion surrounding it, but not recently. I remember us bringing it forward. I mean, it's an ideal time for us to look at several things. The
Yeah.
council's strategic plan ends this year, and so we're kind of looking at really taking the latter part of this year to take stock of what are the things that have been done, where are the gaps that still exist, where do we need to go to move nationally towards making certain things more accessible for older persons, and looking at where the opportunities are to make quick changes that will definitely be positive changes in protecting older people.
I think also we need to look at adding, because for the quality of lives of our elderly, there are certain assisted devices that are required.
Definitely.
They're extremely expensive. You're talking about the elevated toilet seat. If someone has arthritis, that person cannot go down very low to sit. So they need to have access to the elevated toilet seat. They need to have access to walkers. They need to have access to wheelchair. They need the bath benches. There are several devices. We have been fortunate to have access to those, but you know, meeting the needs of the total population
it's daunting.
Is a daunting task.
It's a daunting task.
And so we're extremely thankful for those partners. At the same time, there are entities selling these products, and
the prices are
exorbitant. It's not attainable.
And I mean, there's only one population using it. It's disheartening
and then,
to
you
hear.
know, it's very simple. If you have an older person, and this is just, you know, an example. If you have an older person who needs a walker, then that older person will also need a back bench. Then that older person will more than likely need the toilet lift. Then that person will also need the grab bars. So you're looking at a family then having to invest in a walker, a back bench, elevated toilet seat, grab bars. And I think the grab bars start at what, around $50, Miss Ivorine, for the good one?
About, yes, $50 for the good ones.
A wheelchair can run you anywhere from $350 to $500 without even blinking an eye. The back bench is going to be somewhere between, I think I've seen them as low as $100, but they can go as high as $250. And so you're looking at, a family is going to have to make a decision, what are we really going to afford?
But you know,
and how can we afford it?
There's another part of aging which I didn't realize until really now, which is exercise. I mean, a lot of our older people, apart from not being able to move, there's some of our elderly who can move, but they can't move as much as others. And so it requires therapists coming in, helping them to make sure their circulation is still good. But we're just, listen, I think as a country, we're hypocritical when it comes to old people. And I'll show you just in terms of employment. You just hit a number which is 55, and you're no longer relevant. There's no use for you after 55. We're a public service society. So as soon as you become 55, we have no input from you socially, no input from you politically, no input from you professionally. You disappear.
And they're the expert.
And those are the ones who
those are the experts.
know it all.
They're supposed to be the advisors for this country. And we're underutilizing them.
They disappear.
And if you utilize them, certainly the development of this nation would see a difference.
It would definitely be a different perspective. They disappear, you know, and we do have that break where there's not a transition, where we can look at moving into different facets of life and still seeing the relevance and the importance of having our society engaged at all points in every discussion nationally.
And if you think of retirement at 55, you know, or life expectancy is only increasing.
Your life expectancy is 76, so you're looking at another 21 years, more or less. And if you are healthy and active, then much more.
So this is why we're appealing to our retired professionals to join the HelpAge. We can utilize your skills, we can utilize your experiences to lobby for your needs and to those
advocates.
Come behind. They're advocates. And this is why it is so important. Yes, we may not have the financial wherewithal, but we engage in partnership, you know, and so this is why we will be able to access an occupational therapist, 2 social workers. We're building alliances with local entities because we have to operate on different fronts. Because once we obtain those information, we're able to lobby, we're able to agitate, because it's part of older persons' fundamental rights. Last year, we were able to have the Latin American network coming to Belize, where we were looking at the conventions, the Inter-American Convention on the Rights of Older Persons.
And what it means for our sustainable development goals, because aging plays an important part in the way we go developing. I mean, our retired persons can join HelpAge, they can join Voice, they can collaborate with other agencies in their communities. They can become involved. I think one of the challenges that we do face is that the face of our aging population is changing. Very often people still think of the quiet, nicely grandma who will rock on the veranda, and they don't think about the retired lawyer. They don't think about the retired media personnel. They don't think about the persons who are coming, who is bringing with them wealth of knowledge, ability, and just that space to be able to advocate and move forward. HelpAge Belize celebrated their 3rd annual gala, or their 4th annual?
The
4th annual gala. And it is an event that is so important because I think it brings into perspective the contributions of persons to the development, but it also highlights the continuous work that's happening, and it changes the face of how we look at aging. And you know, it's an important network and connector.
And the engagement is important as well for elderly persons. And I think that that's one of the things, you know, HelpAge does so well with your gatherings and with Voice as their advocacy group. I mean, you guys know I love the Senior Steppers from Belmopan so much. Just because of how it actively engages elderly populations. I do want to say that there are some high points because we've spoken with people who have the formal caregiver program now through
there's BTEC and Red Cross.
BTEC, and it's teaching people how to properly care rather than just having good intentions and perhaps failing in some areas. Mercy Clinic also I know has their it's the only geriatric clinic in the country that serves the elderly population, at least in the Belize district. So there are some bright spots, and so I just wanted to find out, is there anything else in the works that we who are concerned of the situation we just painted, and for the elderly themselves who are watching this, that they can be hopeful for?
I think also we need to share that all the government hospitals throughout the districts cater to our elderly.
They do.
We have had communication with the
Do they have a no-wait policy too?
Yeah, they have special clinic days.
They have special clinic days attached with the HelpAge centers. There are special clinic days. The no-wait policy really depends on if it is a clinic or a hospital and how they strategize prioritizing care. But even in your general your hospital, your clinic, the ones that are run by the government, older persons can go and access, for the most part, their primary care free of cost. And then there are other steps in place to be able to access higher tiers of care, which still needs addressing, but it exists, which is important, that you have kind of that baby step that it exists.
You know, I could imagine, to step into my grandmother's shoes, the sense of fear, of disappointment. Because, I mean, the world that my grandmother was born in 1914 and she died last week. 1914 and 2019 is a world apart. And you were talking about having, Ivorine, you were talking about having persons being productive as long as possible. One of the things for me that does that is technology. A simple thing like my mother, a much happier person simply because she's finally opened up and embraced the world of WhatsApp.
And video calls.
Or Facebook. Well, my mother not Facebook.
Hey, look, the first time my mother made a video call to me when I was traveling for work, there was nobody happier than her. She was like, and I did it myself. I'm sorry, Mom.
And it's so easy, Mom. But the question was, how do we, in terms of empowering them? Because being older makes you feel powerless. I remember lifting my grandmother out her room and walking to she's finally be able to walk now, out to the front. She said, baby, I don't know why I'm so sick. Because my grandmother was a very active person. She would go and give out her tracts, you know, and now she's had a stroke and now she's stuck in the house. But how do we empower older people? By having them embrace technology. Because, I mean, I think maybe the ones that are 40 now will embrace technology as they go older, but we're in a transitional time where people like my grandmother, iPad, TV, internet, I mean,
kind of foolish is that?
No,
but how do we get them? Because it helps them.
Yeah, we have work, we have, you know, engaged in some steps in that area, because we had partnered with BTL, we have partnered with, I think Magic, can't remember the business, a private business, to do training how to
Nice.
text and how to use WhatsApp.
Yeah.
Also, we were
Even
able to...
YouTube. I mean, I remember showing my grandmother how she can listen to hymns or have the
Yeah.
Bible verses read to her.
Yeah.
Yes.
It's like, what is this thing you have here?
Yes, yes. So there are areas that we need to look at and
I
to
think
stimulate them. Also, we got
But
some...
isn't that a great opportunity
Yes.
to change culture if you get like high school students
Yes.
to go in and
we've-
teach them
we've-
themselves?
Yes, we
like,
partner with the high
Yeah.
school student Ministry of Education. We got quite a number of tablets that we issued out to our
Oh,
branches,
that's
you know, to get them engaged in the use of these technologies. And also we promote, we have quite a number of young persons, and we partner with educational institutions at Octavia Waite and in Belize City, where there is this intergenerational
Yeah.
support.
So our intergenerational tool, we have a program called Adopt a Grandparent, which is a mutual learning program. So it's not a case of you going to take care of an older person as much as you mutually adopting each other and enjoying each other's space and company and learning.
Yeah.
And what we discovered during our pilot phase is that they would trade information, like, I taught you to use WhatsApp, so you're teaching me to make preserves.
Yeah.
Or, you know, I taught you to do your email, and so one of the girls learned to do skirts, and the older person that she was learned to sew a skirt, and the older person that she was working with, she was like, and she showed me how to put all the attachment on my email because I'm going to send them one by one, you know, kind of thing. So there are those opportunities with our senior SEPS group in Belmopan. There's been a jump, and they all got on Facebook. So I have a bunch of them as my Facebook friends, and they very often comment things out of the blue. It catch me off guard because I forget that they're there. But there's definitely need to be able to look at how do we integrate our older persons and get them kind of up to speed.
Can I finally? It's a comment and a question at the same time. But I mean, how do we get? My grandmother who died said. I mean, I remember calling her once and she said, "He said, son, he said, I have over 100 great grandchildren. He said, if each of them called me one day separately, I would never be lonely." But there's a disconnect between like grandparents and grandchildren. It's particular, as you said, if you don't live in the same house. How do we encourage families that there is value in getting your the great grandchild to go visit the grandmother, apart from just looking at like a zoo, like that your great granny, to get them to appreciate that there's value in teaching them how do you treat somebody, including you're actually teaching them how to treat you when you become older.
You know, one of the things I learned when I went to do my certificate in social gerontology, and it's why I really refer to older people as elderly, is we say older people because they are still people. And very often when we become older, we stop considering them people. So we don't look for the common connectors. Maybe the great-grandchild loves to dance. Guess what? The grandma used to like dance too. Where is the common ground that they can start to build a relationship? And it's looking at bridging and finding those common grounds to build a relationship, to make the younger person relevant to the older person and the older person relevant to the younger person. And those are discussions that come out in family gatherings, but we have to be looking for them. Because very often when we think about older persons, we think about them in this moment that I have met you. I've met you and you are 70 and I know you as 70. I remember when we did our Adopt a Grandparent program and I was talking to Miss Marjorie Pittsole and she looked at me and she said, do you know I was the first female draftman in Belize? And I was like, what? He said, I know you. I know you think I just the little lady was sitting down at the corner there with the shop with a button and thread. When I was like, that's kind of how I met you. So, but she had an entire career breaking barriers. And we don't think about that in meeting them. And that's one of the reasons I like our Adopt a Grandparent program, because it allows that communication. And I think that's the way we need to go as families. We need to have actual conversations and actually get to know these people. What are the things that they like? Where's the experience that they're coming from? You know, sometimes it's funny because they would have snuck out from their parents the same way the grandchild they try to sneak out. You know, but you don't think about it in that way.
It takes a long time for them to admit that, though.
The older they get, the more candid they are. It's like, who want to do me anything?
You know, ladies, I think the most important takeaway from this conversation is that we all need to make the shift in our own minds as to what we're doing to ensuring that the elderly population, the older people in our families and communities are living a life with dignity, and that we're including them as well.
Definitely.
Thank you for coming in for this very important reminder.
Thank
And
you.
best of luck. And next time you come, we'll give him the arthritis position, right?
I've got some new ones.
Yeah, okay. We're gonna go ahead and take a break. When we come back, from talking about the elderly to talking about our young minds, top PSC performers, when we come back.